So you've been told that you've got blocked fallopian tubes, but how on earth do you go about treating those blocked fallopian tubes so that you can eventually fall pregnant? If you want to know how, keep watching this video. Hi guys, Dr. Katie again, here on Hey Doc, where we address fertility medicine and women's health, as well as other health topics at times. So if women's health and fertility medicine are your thing, be sure to subscribe. So I did a previous video addressing blocked fallopian tubes. We looked at the importance of the fallopian tubes when you're trying to fall pregnant and what can go wrong with your fallopian tubes. In other words, what diseases can lead to blocked fallopian tubes. If you haven't watched that video, do go back. It will be helpful for you to know more by watching that video. But in this video, we're going to go straight for what's most important, which is the treatment for blocked fallopian tubes. We've seen in that video that without healthy fallopian tubes, it will almost be impossible for you to fall pregnant naturally. A quick reminder about what fallopian tubes are. They are these two slender tubes that are part of the female reproductive tract. When an egg is released from the ovary, it is swept up into the fallopian tube, and the egg will remain in the fallopian tube until it is fertilized by a sperm cell. So having healthy and patent fallopian tubes is important because it is going to be the site for fertilization. And once the egg is fertilized, it is where the egg will start making its way down into the uterine cavity, where implantation will happen and the pregnancy will then progress. So given the importance of the fallopian tubes when you're trying to fall pregnant, I would argue that it is crucial for you to know early whether or not your fallopian tubes are patent and healthy. This is going to be particularly the case if time is the essence for you and you notice that you've been trying for over 6 months and you are still not pregnant. So investigating the patency of these tubes is going to be something that you're going to want to do early on, again, so that you are not wasting valuable time. So what are the investigations that you can do to find out whether or not your fallopian tubes are open? Let's start with talking about the gold standard investigation, and that simply means the best way to investigate whether or not your fallopian tubes are healthy. A HCG test is considered to be the best. As a specialized X-ray procedure, it helps to evaluate the structure of the fallopian tubes, but it's not limited to just looking at the fallopian tube. It's also helpful in looking at the structure of the uterine cavity itself. During the procedure, a contrast dye is injected into the uterus through the cervix, and then X-ray images are taken as the dye travels through the fallopian tubes. Blockage or abnormalities in the fallopian tubes can be observed as we look at the flow of the contrast dye. Other techniques like sonohysterography, laparoscopy, and hysteroscopy are also helpful in identifying pelvic abnormalities or diseases that can be associated with tubal blockage. But these imaging modalities cannot directly visualize the patency of the fallopian tubes. Now, onto the ways of clinically handling blocked fallopian tubes. Surgical procedures can be used to address blockage within the fallopian tubes. However, the type of surgery that is performed will depend on the location and the severity of the blockage. When there is blockage of the fallopian tubes, the main way to handle this is through tubal surgery. There are 3 main different types of tubal surgery: tubal recanalization, salpingostomy, and tubal reanastomosis. With salpingostomy, a small incision is made in the fallopian tube and we try to remove the obstruction. Now, this technique is only going to be appropriate when the blockage is minimal. That means during the HSG test, there was still a little bit of contrast dye that could be seen flowing through the fallopian tube. So yes, the fallopian tubes are obstructed, but not blocked. Only then is performing a salpingostomy as a way of treating the fallopian tube appropriate. In my previous video, I discussed all the different reasons why fallopian tubes can be blocked. One of those causes is tubal sterilization, and that is when a woman has her fallopian tubes surgically tied so that there would be no way for the sperm cell to ever meet the egg in the fallopian tube, because basically the fallopian tube has been closed. Let's say that woman, for whatever whatever reason, decides that she's going to have a tubal ligation reversal. So she wants her tubes untied. The only way to be able to undo this surgical contraception is through the procedure known as tubal reanastomosis. During tubal reanastomosis, the small microscopic instrument attached to the end of the laparoscope will be used by the surgeon to remove any ring or clips that have been used to block the fallopian tubes. The surgeon will then reconnect the end of the fallopian tubes to the uterus with very small stitches. There is also tubal recanalization, as previously mentioned. During this procedure, a thin and flexible catheter is inserted into the uterus through the cervix under fluoroscopic guidance, in other words, real-time X-ray. The catheter is advanced into the fallopian tubes. Once a catheter is inserted at the site of the blockage, the contrast dye is injected through the catheter in order to be able to visualize the fallopian tubes and to confirm the location and the extent of the blockage. Once the blockage has been confirmed, various techniques can be used to open up the blocked fallopian tube and with the hope of restoring patency of these tubes. The first technique is the balloon catheter technique. In this technique, a balloon-tipped catheter may be used to mechanically dilate the blocked portion of the fallopian tube. The balloon is then inflated with either saline or contrast dye to widen the opening of the fallopian tube, thereby dislodging any obstruction. The second technique is the guide wire and microcatheter technique. In this technique, a guide wire is inserted through the cervix into the uterine cavity, and as the guide wire is advanced towards the blocked fallopian tube and eventually through the obstruction, it creates a passage which is then followed by the insertion of a microcatheter. And this microcatheter eventually delivers the contrast dye or any other medication with the hope of dissolving the obstruction. Salpingostomy, as previously mentioned, is also considered as a form of tubal recanalization. Now, with all the tubal surgeries that I have just described, you will notice that we are trying to preserve the tube by addressing the blockage itself. However, in some cases, the obstruction and the blockage that has resulted is simply too severe for us to treat the fallopian tube with just an attempt to remove the obstruction. In these cases, we have no other alternative but to resort to a salpingectomy, which is the actual removal of the fallopian tubes. Now, a salpingectomy can be performed through various surgical approaches. We have laparoscopic surgery, which is minimally invasive, and in abdominal surgery, it's actually an open procedure. Then we also have robotic assisted surgery. Salpingectomies are not only the treatment of choice when the tubes are severely blocked, but they are also the treatment of choice when the tubes are filled with fluid, a condition known as hydrosalpinx. It is strongly recommended that if your tubes are blocked because they are filled with fluid, that you undergo the salpingectomy before you go for IVF. The reason why that is that fluid-filled fallopian tubes can impact the success of IVF because the fluid that is found in the fluid-filled fallopian tube can leak into the uterine cavity and affect the endometrium, thereby preventing the implantation of the inserted embryo that happens during IVF. So if you've been told that your tubes are blocked because you have lots of fluid on your fallopian tubes and the doctor that is seeing you is saying, let's go for IVF, IVF is going to be your only way of conceiving, ensure that you do not spend that money before those fluid-filled tubes are removed, because it is very likely that you'll be wasting your money as the IVF procedures are ultimately going to fail. Finally, the only other way that you can conceive if you are going through infertility because of blocked fallopian tubes is through IVF. Why? Because IVF bypasses the fallopian tubes. It involves retrieving the eggs from the ovary, fertilizing them with a sperm cell in a laboratory, allowing the cells to multiply until it reaches a certain level. And then that embryo, being in the lab under certain conditions, then will be transferred into the woman's reproductive tract through the cervix, with the hope that this embryo will then implant itself into the thickened endometrial lining. So you see, doing it that way around means that the fertilization that would normally happen in the fallopian tube has already happened in the lab, in the Petri dish, and it is that embryo that would have normally started to have multiplied on its way down from the fallopian tube. That embryo has been inserted through the cervix and straight into the uterine cavity. So if you have had all the previous treatments that I've mentioned on how to unblock your fallopian tubes, and all those have been unsuccessful for you, or after going through those procedures you then had an ectopic pregnancy, because remember, tubal surgery increases your risk of developing an ectopic pregnancy, and that's a pregnancy that happens outside of the uterine cavity, and you've had various different complications, remember, do not lose hope. You can always go for IVF. Here I go with the scripture again to build your faith and encourage you as you go through your fertility journey. Today's scripture will be taken from 1 Peter chapter 5, verse 6 to 7. Therefore, humble yourself under the mighty hand of God, that he may exalt you in due time, casting all your cares upon him, for he cares for you. Be encouraged, dearest lady, as you trust God to bless you with a child or children. God knows, and as the scripture reminds us, he cares for you. And so I encourage you to draw closer to the Lord as you wait for that precious child or even children. That's it for today's video. I hope you have enjoyed it, and I truly hope it's been helpful. Remember to share this video with someone if you found it helpful, and remember to subscribe and to smash the like button. In the meantime, we will see you later, and as always,